Hester. Hester? Choo-choo. I'm off now, darling.
Good morning.
Good morning.
Did you sleep well?
Yes, thank you.
Me too. Like a baby. Never better. Sit, come. Let's eat.
I still haven't changed how I feel.
There is nothing worse than cold toast.
And you?
I would rather not have any toast at all.
I am not talking about the toast.
And I am. Please, sit down.
I know what I'm doing. We are both grown-ups.
Some more grown up than others.
I am old enough.
And I am too old.
So, it's the age difference, is it?
Jam or marmalade? I think I will have jam. Why don't you say grace?
Dear Lord, thank you for the bounteous gifts, for providing us with tastes and desires and experiences in the most unexpected places. You truly do work in mysterious ways. Someone we may barely notice can suddenly make our hearts beat with love.
Or something. Like a humble piece of toast.
I am not talking about the toast.
And I am. Dr. Carter.
Oh, Mrs. Timmett, I can't seem to find the right keys.
Allow me. Hey, you are early?
Yeah, as are you.
Sometimes it is easier to leave the house and get to work.
I quite agree.
Dr. Carter.
Oh, hello, Lara.
Oh, I am sorry, we are not quite open yet.
I can't wait. I have to be somewhere.
Yeah, I'm sorry. It really is a bit...
I've done what you told me to. Gone away and thought about it. But I know now what I've known for the last 5 years. I don't want children. I never have. I never will. So I've decided...
why don't we have a quick chat in my office?
It's the only reason Mum's alive.
We don't know that. She was in her 40s, already had you. I thought you were going to wait.
I tried. Met someone...
Did you discuss it with him?
What was I supposed to say? Let's get on with it so I can have my ovaries cut out.
You didn't discuss it with him?
What would he have said? What would any man say? And who's to say that he's the one and not just there, available?
You don't know until you've talked about it.
I'd rather just accept that I can't have children.
Thought you were going to wait till you were 30.
I've already waited 5 years and the risk keeps going up.
Well, the odds are in your favour until you're 30.
And what happens after that? Leave it till I'm 35? Or put it all into my career and meet a man who doesn't want children?
What does your mum think?
I should wait. I did tell him, Michael. And shortly after that, we broke up.
You can't make a decision like this on the back of one failed relationship.
I'm not.
You'll meet someone else.
And go through it all again, telling him?
Well, you'll have to.
And then what? After the babies, the operation, and look what happened to Mum and Dad.
We're all different.
Only we're not, are we? I'm not doing this because of Michael. I gave myself 5 years. It's time.
I'm not sure the NHS will agree. You'll find it hard to find a surgeon prepared to do it.
I already have. The best. Miss Swan.
Amina Swan at St Phil's?
You're right about the NHS. They wanted me to wait, which is why I'm going private. I'm having the operation today.
This game.
What is it?
I don't know. I thought it might be important.
Is it addressed to me?
The householder.
It is unlikely to be important. Just leave it there. I will look at it later.
I don't want to leave it.
I am at work. I have not got time for this. Good morning, Dr. Wilson.
Good morning. Hey, you all right, love? A woman just left your room in tears.
She's about to have bilateral salpingo-phorectomy.
She can't be more than 30.
She's 25. She had an aunt who died and a mother who successfully had the procedure.
But she's 25.
Old enough to make her own decisions.
When's she having it done?
Today.
Right, she could have years, maybe a lifetime, just because her mum and her aunt...
I know.
She can't have it done.
Well, apparently, if you go private, you can.
All right, if she's so sure about her decision, why has she come to see you first?
I'm a GP. And I used to be a general surgeon.
You mean you were at her mum's operation?
Her aunt's.
Who you said died?
Found a tumour. Tried to remove it.
How old was she?
35.
So she can definitely afford to wait.
I don't like this any more than you, but there's nothing we can do about it.
The local council are offering grants for insulation.
So you're happy I bought it now?
It was not worth disturbing me for.
Then maybe I should take it back.
No, you never know when these things will come in handy.
Do you think Dr. Casa's patient was okay?
I cannot discuss that. Yes, this could be quite useful. Oh, Mrs. Bonner, I wasn't expecting you.
I just popped in to see Heston. Which room's he in?
Oh, well,
Has he had a tea?
not that I know of. She should not do that.
Do what?
Come and disturb Dr. Carter.
Making someone a cup of tea is not disturbing them.
It is inappropriate.
But the working day hasn't even started yet.
That is not the point.
Well, maybe she works here anyway.
Yes, sometimes, but not today.
I think it is nice calling in on someone unexpectedly you care for. Or maybe I should have bought you a cup of tea instead of a leaflet.
I would have seen this at home anyway.
Never too early. Phillips and Souchong. But you know, I've got that many appointments and home visits today. All without a kiss goodbye from my love. What's the matter? Choo-choo.
I'm worried about a patient.
Oh, is everything all right?
Sorry, I'm going to have to go.
Stop smiling, you make her nauseous. And what kind of a man wants to be a gynecologist? Right, I have a consent form for you to sign. There we are. I can leave that with you.
No, it's fine. I just need a pen, that's all.
Callum Reeves, registrar. I'll be assisting.
Perhaps you can talk Miss Bennett through the procedure?
Total abdominal hysterectomy, bilateral salpingo.
In English?
Complete removal of the womb, both ovaries and the fallopian tubes.
Why?
Preemptive surgery.
Because?
There's a family history.
My aunt died of ovarian cancer when she was 35. She worked here. St Phil's first female surgeon.
Really?
But in the case of herself, she left it too late. The cancer was already there and she died in surgery.
The same surgery your mother had?
But after she'd had children. Aunt Carol put it off too, but because of her career. If she was here now, she'd tell me to stop dithering.
Risks?
Hemorrhage, infection, thrombosis.
Are you sure you want to do this?
Yes.
Right. Okay, I'll see you later.
She's not that bad.
Heard she's very good.
We'll be back to see you later on.
Knight in shining armour, showing a patient the error of her ways. Attractive?
Carol Chandler's niece. I don't want her to do something she'll regret.
But given what happened to Carol,
Well, she can afford to wait 5 years.
I don't see how you can stop it.
Or maybe not her.
You're not going to take on Amina Swan.
I'm trying.
Life in the old dog year. Of course, I'm still trying to get young girls to do things they will regret.
I've got one too.
A girlfriend?
A smartphone.
Really? Know how to use it?
A registrar showed me.
Did she now?
He, bit of a whiz kid.
And you've let him take the flak.
What do you mean?
Well, look after your patients while you play the hero.
No. Anyway, that's the other registrar.
What's he like?
She. Yeah, and before you ask.
No. Look. So what is going on?
Well, if you must know, I'm with someone.
Domestic bliss. How dull.
In the first part, we call it a paragraph part. I set something up, and then in the last part,
Jack, I have a problem to discuss.
I can't know. Thing is,
One that I thought you may know how to deal with. Why, especially with your vast experience of women.
Mate, you've got to stop ruining my chances.
You're right. There's no point to yours being ruined just because of mine. So, what did you write in the last part, eh?
Miss Swan, Dr. Heston Carter.
Erstwhile surgeon.
Lara Bennett's GP.
Forgive me, Dr. Carter. I've got to prepare for theatre.
Yeah, that's what I wanted to talk to you about.
Right. Go get me a coffee. And you make sure he gets it right. Come in.
She's sending you mixed messages.
What do you mean?
She likes you, but she's scared to confront her feelings.
So what do I do?
You need to get some time alone with her. Lots of time. Not jump on her, just get to know each other.
So she confronts her feelings.
And hopefully, by then...
The connection is undeniable.
Well, what I was going to say is that it's so late that she has to say yours. What you really need to do is get out of Mrs. Tembe's house.
Why?
You need your independence. Grab hold of life. And then this woman that you like.
Maybe you're right.
Yeah, well, I should be. With my vast experience.
There are valid clinical reasons for this procedure.
I feel it may be a little precipitous, unduly influenced by what happened to her aunt.
Well, she's unduly influenced.
I don't understand.
Well, it's a little unusual, isn't it? A GP lobbying a surgeon, following his patient into hospital. I know you operated on her aunt.
Well, I was present, but not called upon.
Look, Lara has been facing an impossible decision. Now she's made her choice. She can get on with her life. We have to respect that, maintain a distance.
Is this
you know?
why she's having it done privately?
She has waited long enough.
Or because the NHS won't do it?
No, it's because she wants to have it done now, not next week, not next year. So if you've finished, I'm preparing for theatre. Come on.
Akono, I cannot talk to you. Do not call me here again. Well, I will see you tonight.
You can wear mittens if you have to, just don't scratch, okay? Preston hasn't called.
No, he is not called. And that is not him either.
Asthmatic toddler. I've got an outpatients with Dr. Flynn, discussing new forms of treatment.
Archie Flynn, yes. He's ferocious.
Oh, he's okay. A bit old-fashioned. Is everything all right with your patient?
Not yet.
See you at home, yeah?
Shouldn't be too long now. Miss Swan's on her way down.
So what kind of man does want to be a gynaecologist?
It was my mother's specialism.
And your father?
He's a lawyer. Divorce.
You didn't fancy that?
He left when I was 3.
Mine went when I was 5.
Some blokes just aren't up to it.
Some mothers aren't.
Who bring new life into this world?
Oocyte cryopreservation.
What?
Egg freezing. You can preserve your eggs till you meet someone, then find a surrogate.
I've already told Miss Swan I don't want to.
That way you can have the operation and a realistic chance of having children too.
I don't want it.
What if you change your mind?
I won't. Oh, you're as bad as Mum.
I'm giving you options.
What, just like you would for all your patients?
Yes.
Not just the ones whose aunts you saw die?
I would do the same for anyone.
I've already signed the consent form.
Well, change your mind.
My decision's made.
What if it's the wrong one?
Well, it's better than being indecisive.
Is it?
Everything all right? We'll be taking you up soon.
OK, you're right. Because of your aunt, I am treating you differently.
Actually, we both are.
What are you doing here?
I'm talking to my patient.
My patients. Hey, why didn't you call me?
Should I have? Wasn't sure.
I want you to leave now. Go and get her prepped, and I'll see you upstairs. Well?
Nothing you can do. Better men than you have failed.
Lara is my patient too, and I have as much right to talk to her as you do.
Fine. You talk to her.
You knew my aunt?
I was the anaesthetist at Carol's operation.
And?
And her boyfriend for a while.
You went out with Aunt Carol?
For a while.
She was the love of his life.
And they still let you anaesthetise her?
We'd been finished a long time.
And Carol wanted him to do it.
And I wanted to.
We were professionals operating on a friend and a colleague, and there was no suggestion of any impropriety.
Did you break up with her because she was ill?
No.
We don't want you to do something you'll regret.
But it's better than regretting not doing it, like Aunt Carol.
No word.
Nothing at all.
Maybe we should ring him.
No. Dr. Carter will make the right choice. We have to have faith. When we have faith, we always make the right decision. Now, should I have tea or coffee?
Carol used to talk about you.
Daughter she could never have.
I'm going to ask you to count back from 10. You probably won't get past 5. Then, when you wake up,
It'll all be done.
it'll all be done.
You'd have been happy, not having children.
Well, I hadn't had any.
Carol should have had the operation when she was my age.
Maybe.
If she had, she'd still be alive. Right then.
It's your birthday. You're 25. Is this some kind of deadline?
What if it is?
Right, please, put off this decision for at least another year.
It's exactly what Mum said. Did you ever meet my mum?
Yes.
You know, she hasn't been out with anyone since Dad left. Keeps saying next year. She's sure she'll meet someone next year. Well, she was exactly the same with Aunt Carol. Kept telling her to put off the operation. Why do today what can be put off until tomorrow? Well, I'm sick of her. I don't want children. I don't want my eggs preserved. She should have had the operation when she was my age.
So you wish you'd never been born?
Then be born with the genes she gave me.
Is this about punishing your mother?
She shouldn't have had children.
So you're not going to?
And put them through all this. Why would I?
It's your decision, but you're young. You don't have to do this now. You don't know what's round the corner. But to blame your mother for having you is stupid, ungrateful, and selfish, and Carol would be ashamed of you.
For what it's worth, she was very proud of you. Happy birthday, by the way. So, counting back from 10?
And try and remember that scratching will make it worse, yeah? I know they're students, but 6 of them all with... You don't want to know.
Did Hester make it back?
No, not yet.
I saw him at the hospital.
How did you get on?
Not good, I don't think.
Really?
Oh, that is a shame.
Thought I'd cheer him up, make him something special for supper.
I think I might do the same for O'Connor.
Why, what's wrong with them?
Yeah, homesick. It will pass. The young are resilient.
I'm going to try Heston again.
Dr. Carter?
Laura. What happened?
I changed my mind. Must have been the shock of you shouting at me.
Sorry.
Don't be. Auntie Carol would have done the same.
How did Miss Swan react when you said you wouldn't go through with it?
She seemed relieved.
Seems like a nice boy.
Sort of man that wants to be a gynecologist.
I think he likes you.
He does know everything about me. Wouldn't need to tell him anything.
See?
Maybe too much.
Maybe. I'll leave you to it.
And I'll see you in a year.
What made you change your mind?
Bit of everything, really.
Yeah?
This looks very special.
It is just a normal supper.
Oh, it doesn't look like a normal supper.
This time I will say grace. Bless, O Father, thy gift to our use and us to thy service. For Christ's sake, amen.
In other words, embrace life, people, enjoy new things.
Oh, I am. And if I say so myself, it tastes delicious.
Ntwa, Kaglo, Kea, Malomo.
You know Setswana?
I found it on the internet. The highest form of war is dialogue. Anyone is allowed to talk, to express their views, but you don't want to hear mine.
No, that is not true.
All we ever talk about is food, even though I tried to kiss you. I think I should leave.
No. The Reverend wanted you to stay here. If you leave now, it would be a failure and a betrayal of the church's kindness.
And that's the only reason why you want me to stay?
Yes.
Yes. You're right. Delicious.
Hello, darling. Did you get my call?
My battery ran out.
Oh, no.
Tried
tried to get Lara to have her eggs frozen.
And?
She didn't have the operation. She's going to wait another year.
Oh, Choo-Choo, that's wonderful. You're wonderful. Mm.
I'm not.
Yes, you are. You are a wonderful person.
Like all God's creatures.
Although you don't like to take compliments. Thank you so much for your hospitality, your food.
You do not have to go.
I think it's best. Take care, Mrs. Tembe.
And you, Kono.
I'd like you to leave. Now.
No. You all right?
I'm not sure.
She's faking it. Can't believe you fall for this.
You think I don't know what you do?
It's not what you think.
Once you start, you can't stop.
Cherry, you are blowing this out of all proportion.
The whole wedding's ruined.
Cherry!
This is supposed to be the happiest day of my life.
Tonight on